As a young child, I always liked taking care of people. My sister had scoliosis. So years ago when you had scoliosis, you were in a full body cast, not like they can fix it now. So I remember her being in our living room because that's where she had to be so my mother could care for her in a bed, like full body cast for a long period of time. And seeing my mother take care of her and being able to do my part, like it would be little things, but to know that that helped my sister just brought so much joy to me that I was like, oh, wow. And in addition, my mother was a nursing assistant. She would come home and tell me stories about how she helped babies. She worked in the nursery. And I just thought that was so exciting. At first, I thought I wanted to be like Oprah Winfrey and have my own talk show, but that changed. And so my mother told me to volunteer in a hospital. And I did do some of that. And nursing was just like the thing for me. I felt like I was always driven, and that was always my purpose. I'm a very spirit-filled or faith, and I just feel like God just put things in place, and nursing is where I've always meant to be, and that's always where I've been. So I worked bedside nursing or in a hospital for 15 years. Then I ended up in academia. So the way that happened, I was on the floor, and a friend of mine was already in academia where she would go in and help and do clinical groups. And she asked me to cover her clinical group for her once. And I was like, oh, okay, just because you're my friend, I'll do it. I fell in love. Seeing the students and being able to impart the knowledge I had to help them help the patients and become these great nurses, it was just great. I remember one night I was looking over my students' names and I was so excited I couldn't sleep. And my husband was like, what are you doing? I'm like, this is my clinical group for tomorrow. He was like, you need to do that full time. And so that's when I realized, okay, yeah, academia is something I need to, find out more about. How do I prepare myself for that? So I found out that I needed a master's degree. And lo and behold, I'm at work, bedside nursing on a unit, and the educator for the hospital, who I'd never met, came to me and she was like, you're a great nurse. You should be a educator. Here's an application. Apply for a scholarship as well. And I thought, I said, well, won't hurt. And I applied. I got accepted into the program, and I had gotten a scholarship for full ride to pay for everything. So I just thought that was my path, and I followed it that way. And then I got into academia, and I wanted to stay in a hospital. So I was only doing it part-time for a minute. And I was told, if you're going to do this full-time, you're going to need to get your doctorate and kind of stay in here and do what you need to do. And that's when I ended up going back to get my doctoral degree. And I have been in academia for 10 years now, maybe 12. So I enjoy it. I just feel like that's where I need to be. That's always been my purpose, my passion. Yes, as a bedside nurse, some of the things that I believe you probably have heard from other nurses, just the patient load. And then for me, being an African American, definitely always feeling like I have to be better. I have to be better than the nurses. I have to know everything because I always felt like there was a setup for me not to be successful, unfortunately, because of my race. So I had that pressure of always needing to know everything, do well with everything. I do remember some patients also not wanting me as a nurse because I was African American. So again, always feeling like I have to be, the best of the best. And that was an extra pressure for me. But I was able to deal with that because, yeah, it made me know that better. Do that a little different, and kind of strive to be the best that I could be at everything. So it really helped me out because most of the time I was pretty good with what I did, and I appreciate that. That just gave me that extra motivation to be better.
So good afternoon, everyone. My name's Mary Anderson. I use she, her pronouns, and I am the Director of Advocacy and Outreach for AARP Illinois. As you heard earlier, I have been working with Gene Axius, our Senior Vice President of Global Thought Leadership, and his fantastic team for our Disparities Enterprise strategy we have here at AARP that we've been working on for about the last 2 years. And I am honored to be co-leading this group of work with my colleague, Wynn Quinn, who you've met earlier today. And in fact, I think she literally knows every single person in this room and possibly everybody watching online. So this Health Equity Summit is just one piece of a large, robust group of work that we're doing at AARP to address health equity and health disparities amongst older adults of color and across for the 50 plus. Now, I love working with the Center to Champion Nursing in America and our colleagues, Susan Reinhardt and Jen Peed. And in particular, as you heard earlier today, they have a very important report on the future of nursing 2020-2030. I think it was actually one of our calls to action in one of our previous panels. And that has really provided the roadmap to how we can change and chart a path to achieve health equity in our healthcare systems. Now, this report is an amazing tool that we can actually take many of these discussions we've been having today and make them actual reality. So now we're ready to move forward to our final panel, and this is when the rubber hits the road. It's making the commitment. So I'm going to turn it over to our fantastic moderator, Dr. Debbie Stamps.
Thank you so much. Good afternoon, everyone. Uh-oh. Good afternoon, everyone. Awesome. I'm Debbie Stamps, and I'm one of the New York State Action Coalition co-leads. And I'm also an active member of Chi Eta Phi Sorority Incorporated, which is a professional nursing organization of both male and female registered nurses and student nurses. I recently transitioned from a long-serving executive leadership role in a health system in Rochester, which I was also the founding president of our College of Health Careers and the inaugural chief diversity officer. And I have transitioned to having my own consulting business. And what I really appreciate about today is the fact that this brings all my passions together. Healthcare disparities, addressing healthcare disparities, addressing the diversity of the workforce, looking at inclusion, and social justice. I want to also thank and acknowledge Jasmine Cooper and Winifred Quinn. The CCNA's mentoring support program for historically black colleges and universities is under their leadership, and I've had the opportunity to work with both of them for a period of time, and they are just fantastic. I also like to follow the same process that we had earlier, and really start out with our panelists to give a brief introduction of themselves. Tell us your name, your affiliation, and your title, and then we'll get into more of the discussion. We'll start with Taquana.
Hello, my name is Taquana Holly. I am a clinical educator at Robert Wood Johnson Barnabas Health, Pacifically Monmouth Medical Center with a specialty in critical care.
Good afternoon, everyone. My name is Marcus Henderson. I am a board member, the director at large, recent graduate on the American Nurses Association Board of Directors, and a PhD student at the Johns Hopkins School of Nursing.
Good afternoon, everybody. My name is Simi King. I am the Chief Nursing Informatics and Education Officer at Children's National Hospital here in Washington, D.C. But on the panel today, I am representing the American Organization for Nursing Leadership, and I serve as the treasurer on the board of directors.
Hello, everyone. My name is Adriana Nava. I am a research scientist at the National Committee for Quality Assurance, NCQA, and I'm here representing as president of the National Association of Hispanic Nurses.
Hello, good afternoon. I'm Deneen Richmond. I'm the president at Luminous Health Doctors Community Medical Center in Prince George's County, Maryland, basically right outside of Washington, D.C.
Awesome. Thank you so much. What an amazing panel we have for you this afternoon. I'd like to start with Taquana. Taquana, can you tell us a little bit about what it's like to work at RWJ Barnabas Health in New Jersey?
As a nurse, I love being a nurse. Working as a black nurse is something totally different. Let me just give you some historical information about me so you can understand the experience. I am a single mother. When I went to nursing school, I was working a full-time job, going to nursing school part-time, and taking care of a child. We had clinical, The clinical ran over. It was 11:30. I had to be at work at 6 o'clock. I went up to the instructor and I told her, listen, I need to leave because I have to go to work in the morning. She told me, and I quote, you will never be able to finish nursing school working a full-time job and trying to do this, so you need to quit. Needless to say, I obtained a scholarship for the last 2 classes, finished, I believe it was 4 out of 75. But that did also set the tone of the narrative to where, because of my life and some of the things that I have to go through, I had to work twice as hard to get to the end road. And that continued in my nursing career. I had to demonstrate that I was twice as qualified as some other colleagues to escalate and to navigate through the system. Conversations were never had to me about, okay, Taquana, tell me what you want to do. Tell me something what's your career aspect? What do you want to do? Do you want to change degrees? Do you want to go try something else? Every opportunity that I've obtained because I did it. I got a master's because I wanted one. Because my mother said, why not? Go for it. I got a doctorate because I wanted one. Not because anybody put any vested interest in what it is I was doing and wanted to know what was the next step for me. Because I wanted to be the example to what Rear Admiral Mick said to the next Taquana behind me to say, oh, well, listen, Taquana went from an associate's degree nurse to now as a doctorate prepared nurse. And I also wanted to leave that legacy behind for my 2 boys because I am a single mother. And that has also empowered me to recognize the power of my voice, something I didn't have when I first became a nurse because I navigated through alone. But nobody should have to go through the system alone where you feel like you're challenged to keep proving yourself every day. Every day, you got to say, I'm good enough and I can rock and I can do this. To just have a seat at the table, we don't have.
Thank you for sharing your journey. Can you tell us, who does your facility serve? And then what is your job there?
So it's a community-based facility. It's a teaching hospital. We serve a wide variety of different populations, from the Orthodox Jewish community to underserved, vulnerable communities. My job is different because, again, I fight for myself, so I'm not just a critical care educator. I actually know how to do several different things. So I can actually flip and become an ICU nurse. I can flip and become a nursing supervisor. I can actually flip and become a rapid response nurse, and I can be a teacher. And during the course of my job, I'm able to incorporate all those different things into what I do as I navigate through my nursing career.
What is it like working with leaders of color?
Well, if I had some, I would tell you. But unfortunately, I don't have any currently at my facility. What I will tell you is that in order for them to understand the impact and what that has on somebody who's trying to get to a leadership position, is that sometimes you have to kick down the door and let them know, hey, I'm here. And I'm telling you, I want to do this. So can you pay attention to me? Because if not, I'm going to navigate through and go around you to find a way to get here.
I'm going to ask the panel for any comments.
I'll start. First of all, Taquana, thank you for sharing. I think that you speak on behalf of many who feel the same way, and I think it's difficult to be vulnerable in front of others, and I think that, well, first of all, thank you for doing that. Your journey clearly, I think, resembles the journey of many. So when you stand here or sit here today, when you think about that, what would be the advice that you would give to a person who might be experiencing similar experiences where they don't see someone who looks like them in their leadership environment, and how can they navigate the way that you have so successfully to achieve the same successful outcomes?
That's a good question to me. The first thing I will always say is the first person you have to believe in is yourself. Self-doubt doesn't really play a mode in my realm because it can't, or else I wouldn't be able to say now, because it took me a long time to humble myself and say that I was actually Dr. Holland. Because I had the doctorate for 2 years, but I never used the title. And also, never be afraid to speak. We're quiet for so long that it just becomes, how can I say it, second nature, and to where we become complacent or we don't want to say anything for fear of, I don't know who said it, of the retaliation. Because if I talk up, then I might lose my job. And I still have a whole entire family to feed. And I think that's the one thing I would tell people is that sometimes you got to say, forget it, I'm tired. I'm tired of having to struggle every day to show you that I can do exactly what, and I don't want to offend anybody, but I can do exactly what this Caucasian person can do, but you're so busy talking to her about what she wants to do, does she want a master's, and how can you help her get there? But for me, you're just like, okay, well, your evaluation is good. Just keep doing what you're doing. Thank you for working.
Taquana, our purpose in nursing is to provide care to our patients and ensure quality outcomes. How is that achieved in your organization for people of color?
It's a work in progress. That's what I can tell you. Only because I've had lived experiences where, unfortunately, I have met family members who, I'm not gonna lie, have come to hospitals that are associated with us. And the stories that they tell me are not ones that I want to hear, where they say that their voice hasn't been heard. And what I try to teach the new nurses that are coming in is that these are human beings. All human beings have an active voice, and human beings are connected to a whole other system you don't know anything about. And nobody knows them and their life better than they do. So the minute you tell them to shush, be quiet, and just answer these questions, you're discounting their voice. So you're not going to be able to give them the care that they deserve. So you need to stop and listen, because everybody deserves an opportunity to talk for themselves and advocate and let you know who they are and their authentic experience of where they are in their life.
Thank you for sharing your insights, your experience, and your journey. It's very humbling to hear this, and really proud and happy that you are strong.
Thank you.
I'm sure that's taken some supports. You've had some external supports to...
Yes, I have. I have a wonderful, lovely support system. And also, I want to acknowledge Miss Deanna, who has been instrumental in me learning the value of the voice.
Awesome. Thank you. Thank you. Is there any other insights from our panel that you'd like to share? Anyone would like to share?
I would just like to share that, I mean, your advocacy for yourself, your perseverance is just amazing. But we all also have an obligation so that everybody doesn't continue to have to go through, or their path doesn't have to look the exact same way that yours did. You know, the fact that when you said there's, you know, no one in your hospital in an executive leadership role that looks like you. You know, I'm now part of a group, the American Hospital Association, this year started a hospital CEO roundtable, because less than 5% of hospitals in the United States are run by Black women who look like me. And so we have to be the ones that are, it's not always just about mentorship and support, but we have to sponsor people. We have to provide those same opportunities that you talked about that you did not get as you admirably climbed that ladder. And so that, I think, is all of our responsibility to think about, you know, not just listening to your story, but what is each and every one of us going to do about it?
I'd like to add, and I really like the question about how many nurses of color or leaders of color have you worked for? And I was thinking about that for myself, and I know hasn't been many, if any, to be honest. And I'm a millennial, so I have had a couple of jobs, and I've never had another Latina leader. And it wasn't until I became a leader myself when I would hear my employees and they would say, wow, like you really opened the door for us to be our authentic selves, where we can come in, talk about the challenges and barriers that we're facing. And it was really nice to hear, but also really sad, because I know before I was there, they didn't have somewhere to go. So they had to keep it to themselves if they were coming with challenges or facing discrimination, and nobody would listen to them. They had to hold that with them every day at work and take it home with them. So that was really unfortunate.
Thank you for sharing that. That's awesome.
I'll also add, I also think that that's a really important question. I think my nursing career has been really interesting. I've had many nurse leaders who have been people of color, whether they're male or female. And interestingly, though, none of them look like me, right? Because I'm from India. And the population of nurses in this country who might be from India is very little. And most of the time I walk into our room and I'm the only Indian nurse. And so it's very rare that I've ever been in a room where someone looks like me, although I see someone right now. But it's not common. And so, but I do think that, you do have to also find your allies. You have to find the individuals who are willing to invest in you. And it does take some courage to put yourself out there in order for that to happen and allow that, that investment to occur. Because I know for myself personally, when I entered nursing, I never expected to achieve what I have achieved, because I didn't think that I was that person, and I didn't think that I would be given those opportunities either. So I do think it's very important to be open to allow others to pour into you.
Thank you. Thank you. Did you want to?
Well, I was just going to add quickly, I mean, that what I heard is the reason why we're all here, and your story is the value and the reason why we need diverse nursing leadership. And I think about trauma-informed, how we all need to look at each other and say, what has happened to you? And what do you need? Equity is what you need, when you need it, and how you need it. So that's what comes to mind, and that's the value of why we're all here and what we're doing and why we do what we do. But we have a long way to go.
Thank you. Marcus, can you please share with us the strategy that the American Nurses Association is implementing to address diversity, equity, and inclusion in nursing, and also what your organization is doing to address structural racism?
Yes, thank you so much for that question, the opportunity to be here to represent the ANA and our president, Dr. Grant. Big shoes to fill, literally. But I think the first thing that comes to mind coming after my esteemed colleague here is, ANA has been in an outward journey related to DEI and anti-racism since 2020. Why? The inflection point, George Floyd was murdered. And I think it's important to acknowledge that it shouldn't have taken that point for us to be in this space. It was long overdue. But we're here, and we're doing work to right those wrongs, because we, the American Nurses Association, have contributed to the harm and the perpetuation of injustice and racism in our profession and society. So we are partly to blame for the harms you've experienced in your career, and I'm here to acknowledge that on behalf of the ANA and what we're doing to move forward. And starting that journey in 2020, our membership assembly said, we're going to adopt a resolution, racial justice for communities of color. So we said that we cared. But I think many organizations at that same time were saying that they cared in their statements and press releases. But it's not just saying what you care, it's showing how you care. So words into action. And we knew, the ANA board knew, that we couldn't just make a statement and then not do anything about it. And we have a diverse board, and I think that was the value in us propelling forward since 2020 because of the individual voices that are represented on our board, myself being one. So we began that journey, like I said, in 2020, where we affirmed our commitment to address DEI in nursing. So the three areas I'll talk about briefly are, one, our strategic plan, our journey of racial reckoning that started this past June, and then, of course, the National Commission to Address Racism in Nursing. So one being the strategic plan. Every organization has one. And in 2020, every July, the entity boards of the American Nurses Association Enterprise, so that's ANA, ANCC, and the American Nurses Foundation, we meet annually together as a board to discuss the strategy of the organization. And immediately in July of 2020, we amended that plan to include an objective, address racism in nursing. So we recognized at that point in time that we as an organization across an enterprise that we needed to advance the work related to DEI and anti-racism, and that's really where the National Commission came to be. We said we need to partner with organizations, so we called NBNA, we called National Association of Hispanic Nurses, and NCIMA, and said we need to come together and do this. So that was the first step we took as a part of our strategic plan, is convening that co-led group. Again, ANA doesn't own that work, it's co-led by those four organizations. But it's important to note that ANA is providing the staff and resources to support that commission, and we commit to do so moving forward as we end the first 2 years of the commission's work. And then for our new strategic plan that will be launching in January, we upped the ante again. We have our three goals: elevate the profession, evolve the practice of nursing, and ensure the professional success of nurses. And goal 2, that evolve the practice of nursing, I would say is really our DEI and anti-racism goal. It's how are we advancing this work across work environments and in practice? And how are we not only supporting the commission, but also our journey of racial reckoning? So I talked in July of 2022, ANA's membership assembly approved our statement, where we acknowledge the past harms that our association has contributed to our profession, and we want to right the wrongs. And we offer some strategies in how we're doing that, direct reconciliation with ethnic minority nurse associations, and we're doing that. So far, we've met with 4 organizations to say, again, equity-centered. How did we harm you? What do you need? When do you need it? And how do you need it? Is the mindset that we're taking with that approach. Other things related to our strategic plan and our racial reckoning. I know I'm talking about all these things kind of in tandem because they really all flow together, but some of the other items that I wanted to talk about, were talking about how we're going to develop an equity impact analysis in our policies and position statements that we have as an organization moving forward. Establishing a formal DEIB plan. We don't have one. So we need to fix that and document such things. And then again, the value of having a diverse board, staff, senior leaders. I think we've talked about what that value looks like. Diverse perspectives in the room challenge the status quo because we look at things differently. So really embedding that, it's not always about, I always challenge folks to ask the question, not is everybody that's supposed to be at the table, but who's missing from the table? Whose voices have we intentionally marginalized? Whose voices have we intentionally silenced? And bring those folks to the table. Again, it's the sponsorship piece. It's bring the chair and sponsor them at the table because otherwise they won't know that those opportunities are available to them. And I think that the biggest piece, and what I hope I would challenge everybody virtually and in this room is, we're taking this outward journey. We want to hold ourselves accountable, but we need you to hold us accountable. I can tell you, and our board is very committed to this cause, and I'll ensure as long as I'm there that my voice will be heard, moving this work forward. But that's just a little bit about, what we're doing. It's certainly more than that, and that's, very limited in the time I have, but I just, make the point that we are committed to this. Are we going to get it right? No. We're all human beings, and we're all on this journey differently, but that's what the accountability piece is about. When we don't do it right, tell us and help us to right our wrongs.
Thank you, Marcus. It has been impressive, the work that the ANA has been doing, the Commission on Racism in Nursing and the ECHO series has been very educational. It also opens up a lot of wounds each week with some of the experiences that we've had over time. I want to thank you for the point you made about thinking about who's not at the table, because a lot of times we don't think about that. We want to make sure we have people there, but we're not always thinking about, okay, who's missing? And so thank you for that acknowledgement. Panel, any insights to add?
I don't mind going first again. I just want to say that, one of the things that has really stuck with me over the work that the Commission on Racism has been doing is the definition of racism and the fact that the Commission was brave enough and had the courage to use the word an assault on your personal self and well-being. And I think that, it was a strong word. It was and at first it caught me off guard, but I feel like it was a necessary word. And I just want to applaud the Commission for being able to really be comfortable with saying something as it is and not skirting around it. And can you kind of, being a part of that work, kind of share maybe how you got there as a commission?
Many, many conversations. I see some of my fellow commissioners in the room. But I think, you hit the nail on the head. We wanted to speak directly to the action that was occurring, the harm that individual nurses are experiencing every day. And I think that definition has really guided our work from, again, this is a co-led effort, but our listening sessions, our survey, the voices of nurses guide the work that we do on that commission every time, we put out a statement, we develop a new educational material, because again, it's that assault, it's that harm that directly occurs. And I think one of the other pieces is a lot of the definitions out there at that higher structural level. And we talked about that. Of course, we looked at multiple definitions of racism to figure out what definition is unique to nursing. And we had that discussion to say, we really want to call attention here to the individual nurse and what that experience is to them, because it's inherently structural. It's a symptom of a deeper root cause. So it's inherently structural, and we wanted to give rise to that individual experience, again, so people felt heard, felt seen. And my colleagues speak on this work often, and I think every time we speak on the Commission's work, somebody gets up in the room and says, thank you, I finally feel heard. And that's the most fulfilling thing for me.
So I think during the course of all three panels, all of us have heard a recurrent theme about the importance of the voice and what that means. And I think what the ANA has demonstrated is that, yes, the voice is important, but there is the process of listening. There is the need to listen with intention and purpose to actively hear what people are saying. And I think the verbiage that you used, that Simi referred to as assault, meant that you recognized and you heard what the voices were saying to acknowledge and to help make amends and develop different processes to raise awareness that this is the experience and this is what we go through. How are we going to work together and collaborate? So I actually commend you guys on actually working in that process using active listening for intentional purposes.
Thank you. Thank you, Marcus. Simi, you're here today representing the American Organization of Nursing Leadership. And this is an association of nursing leadership in all settings. So acute care, ambulatory, long-term care, post-acute care. Can you please share with us what the organization is doing regarding DEI?
Yeah, absolutely. Thank you for this opportunity to kind of dig into really looking at it from the lens of a professional organization whose commitment is really to educate and prepare nurse leaders and to ensure that they have the competencies to really help propel the role of the nurse leader strategically and to meet the demands of our healthcare environment and ecosystem. One of the things I think that my colleague already mentioned, Deneen, was really understanding nursing leadership in the context of data. And she already shared with us that when you look at the data in healthcare, about 70% of the healthcare workforce is women. And when you take it down to the level of nursing, about 80% of nurses are Caucasian and about 9% are represented by men. But then you start to look at nursing leadership, and as Deneen pointed out just a few minutes ago, only 5% of nurse leaders are represented by a person of color. And so we know that although I think earlier it was mentioned by Dr. Beard that we've had data about diversity in healthcare for years. And those data should have been a catalyst to action a long time ago, but they haven't been. And so we have to ask ourselves why, like what is getting in the way? And so Marcus just mentioned that ANA has been looking at this outwardly. The work at AONL really has been an inward kind of process from the last couple of years. I've been fortunate to be a member of the AONL since 2019. And actually, in my first meeting at AONL, I learned that they were changing their name. And for many of you who may have been members of this professional organization, you'll know that prior to that, they were AONE, the American Organization of Nurse Executives. There's an exclusivity attached to that. It doesn't feel very inclusive. And the organization themselves understood that and were listening and learning from other nurse leaders in not just healthcare systems across different care areas like acute care, post-acute care, long-term care, but also nurse leaders who are serving in industry, nurse leaders who are in academia. AONL really is an organization for all nurses in all settings, but were we really saying that out loud? And were we really bringing others in and making them feel included? And were we creating an environment when they were part of the organization in which they felt like they belonged? And so shortly after the events of 2020 with George Floyd, AONL also embarked upon a journey in which we started to really look at how do we help to support increased membership of diverse nurse leaders within our organization, and what does that look like? And we started our Diversity and Belonging Committee. And at first it was going to be the Diversity and Inclusion Committee, and then it was going to be the Diversity, Equity, and Inclusion Committee. And we landed on the Diversity and Belonging Committee because we recognized diversity really is just counting numbers, right? There's 5 of you and 7 of you, and it's really more of a number thing. And inclusion is, yes, you're here. We're all here on this panel, sitting here together. We've all been included, and we have an equitable voice. We're all giving a chance to speak and have that same opportunity. But do we really feel like we belong here? Like, do we really feel that comfortable that this is where we're supposed to be and that we're really a member of this group? And I think that that's a really important piece. When you walk into a room to actually feel like, yeah, feels like home, this is where I should be. And that's something that the AONL is really committed to doing, is when you are a member of that group, that you're not just paying your dues every year, or you don't just attend a conference every once in a while, but you're really an individual who feels like they're part of a larger group of united, diverse nurse leaders who are committed to improving health and healthcare and health outcomes and equity. So how have we done that? So we can say we're going to do it, but how are we doing it? And AONL actually worked with an external consultant who came in and took a deep dive with the organization And through that work, there were recommendations, and that work occurred through surveys, through focus groups, very intentional communication with board members as well as members. And those recommendations helped us understand that we really needed to start with a few things, such as, what does our leadership at the top look like? What does the AONL board look like? And so the last year, and you might have noticed if you're a voting member of AONL, that this year's slate looked different. And rather than the normal 2 persons on each for each position that might be open for elected positions, the slate was larger. And that was really intentional. The nominations committee worked with the diversity and belonging committee to really think about not just the criteria for an elected position, but how do we diversify the opportunities for individuals to feel comfortable to put their name in the hat for those positions and run for office. And so we did have the most diverse pool of candidates this year in our 2022 elections. The current AONL board is very diverse, not just in representation of gender and race, but also the spaces and places where they work and represent nursing leadership. Our next step right now as part of AONL is to look at our appointed board members committee. And as I said earlier, I was an appointed board member. And that process is an application process, and then you wait patiently and you hope you get on. And I was fortunate to be a member. And when they shared with me why they selected me, it was my informatics background and my experience as a CNIO, which they didn't feel was being represented at that level of thought leadership and nursing leadership on that board. And so they are very intentional in really looking at the gaps in representation of the appointed board member process and really making sure that we're looking at those places where nurses are leading and are they represented on this board. And we're continuing to refine that process as we're going through our current board member process. So those are some of the ways AONL is really looking at how do we diversify the representation nationally of nurse leaders as the professional organization that serves nurse leaders.
Thank you so much. Any comments from other panelists?
I think I would just add, you bring up a very good point about how are we assessing and looking at diversity when we're appointing board members, assigning people to committees. You know, I think it's often we defer to expertise, we defer to the individual with the doctorate, but like was said earlier, you don't need 10 to 15 years of experience, you don't need a doctorate degree, you don't need an RN, you don't need all of these things to qualify you as a leader, to give your expertise to a committee or to a board, because it's not just your education, it's not just the letters behind your name, but it's your lived experience. It's where you grew up, how you grew up, social determinants of health. That's the other expertise that we need to value at the board table, and I think, you know, that's what AONL's doing, that's what ANA's doing in our appointments process as well, because we recognize it's just not who has the most years of experience and the highest paid degree and what university that degree's from, but rather how are we assessing individuals and what they bring to the table for who they are as a person, not just their education and credentials.
And I really like that concept of belonging. And I think, especially as a Latina nurse, I've always felt that in order to belong into leadership, I needed to have a PhD, get a second master's, have all these credentials just to justify that I belong in leadership. So I think making it inclusive and making you feel like you belong in leadership despite, you know, other attributes that you bring to the table, whether it's your experience, whether it's lived or work experience, your ability to network, have those soft skills are also important to acknowledge, and not just, you know, trying to rack up academics just to prove that you belong in a position of leadership.
Yeah, can I just respond to that? I think that's just so important, and one of the things I do want to mention also, AONL does have a Young Professionals Voice program, and we do look for individuals to be a part of the organization as a young professional voice, because to your point, you can learn a lot from anybody. Right? There's reciprocity in almost every relationship. And I learned so much from the new nurse residents that come through my residency program. And I learned so much from an experienced nurse leader. And so we really do have to think about the opportunity to diversify thought as we're thinking about trying to really propel into the future and not be so exclusive in who can be on that team.
Thank you so much, Simi. And it's nice to hear that there was an assessment of the organization and action is being taken. It's awesome. Adriana, would you like to share with us a little bit about the National Association of Hispanic Nurses? They've had a long-standing focus on diversity, equity, and inclusion, and like to hear a little bit about that and how things have changed over the last few years.
Sure, thank you. So for those who are not aware, the National Association of Hispanic Nurses was founded in 1975, so we're a little under 50 years in existence. Not quite long enough to create change, but we're definitely building our structure so that we can get there. But in doing that, a lot of our work is twofold. So first, we focus on developing the nursing workforce, specifically Latinos, to pursue higher levels of academic success, but also for them to pursue opportunities in leadership. And we do that by, especially locally, our local chapter provides scholarships, but then they also contribute to the community by doing and hosting health fairs, giving students, but also nurses the opportunity to be forward-facing within the community and build their networks. And then at the national level, we amplify that with further opportunities for scholarships, but then we also host annual conference, and more recently, we're having a policy summit that we're having in February of 2023, and that is one of the first ways that we're now contributing to advancing Latino health priorities at the national level and making a focus on some of the health equity issues that our community faces. And the second focus that we have is focusing on health equity and how do we improve health outcomes for our Latino community. And over time, since we are a professional organization that has been in existence for a little under 50 years, we do have a few challenges since a lot of our members are volunteers. So they have their professional work that they're doing on top of their volunteer service. So that has been a challenge that we've faced over time. But luckily, we've had really strong presidents over time that have been able to keep the organization going, building partnership, building corporate members, and that has really helped us to enhance our mission and create more strategy as we go forward. So we did notice during the pandemic and with worsening health outcomes for the Latino community, but also the murder of George Floyd, that there was also internal work that we needed to do as an organization, because we noticed that our members were saying that as Latinos, we also have to discuss and acknowledge that there's racism and discrimination within our own population. So our community, even though we're together ethnicity, we actually are quite diverse. So we have Afro-Latinos, we have Asian Latinos, we have white Latinos, we have a very different diverse pool. So these topics really affect our ethnicity as well. And a lot of times we don't talk about it, and it kind of goes under the rug, or people don't feel safe to speak about it. So we wanted to acknowledge that it is an issue within our organization and something that we need to face and talk about. So as we go into 2023, we focused on 3 strategic goals. The first one is building psychological safety. We really want to make sure that our members feel safe within our organization, and if there are issues, that they're able to bring it up to the board level, so that way we can come up with strategies to address those. And this is really important because a lot of our students, when they come to NAN, they're looking for mentorship, they're looking for guidance, for role models. And if we can't show them the right way to address racism or discrimination within our own organization, then who do they go to? Because they're not going to be at their employer and getting that information or concepts. So we've really put a focus on building psychological safety within our organization, and we started that by sending a survey through our DEI committee that was reestablished in the past year to get a sense of where our organization is at, and then some of the ideas from the members of how we can enhance the work that we need to do as NAN. So the second thing that we're focused on is building the structure. So as we move forward and we want to be a bigger organization, have a larger voice and impact for our Latino community, we're really focused on building a chapter in every state. Right now, we have 40 chapters in 24 states, so we have a lot of room to grow. And we do more recently, we know in New Mexico, there's a good number of Latinos in that state, but we don't have a chapter. So we're happy to share that we're forming a chapter there finally after lots of years, but we really want to see that progress go throughout the country. And I know my colleague in Iowa, I was talking to him yesterday, Jimmy, about how do we start a chapter in Iowa. So we have a lot of room to go in order to get a chapter in every state. But in order to do that, we want to focus on building the structure. So making sure that we have policies in place, making sure that our local chapters have the support from our administrative staff to be able to go to and have, information that they don't have to build on their own because they are volunteers. And then the third one is building a health policy voice in Washington, D.C. So we really want to build our networks with the federal government. We have great ideas coming up with the USDA focused on nutrition security, and since that was a White House priority, and just aligning a lot of our goals and mission with some of the federal initiatives to elevate not only our voice as but our voice as nurses, and as nurses that we have the power and the ability to impact the lives of the communities that we serve. So those are some of the things that we have been focusing on. But we really tie that all into building the capacity of our nurses as leaders to have the voice and influence to impact the health of the Latino community.
I think that it's actually phenomenal that you are looking inwardly as well and looking at the own implicit biases that separate the different types of Hispanics in the whole organization. I find that sometimes in the African American organizations, we don't necessarily do that because we do have our own implicit biases, and sometimes it does diminish the effect of what it is we're trying to do as an overall organization, because there's enough room at the table for all of us. We can all sit and have a seat and try to get to the top, but when other people are trying to tear you down because they have some own biases going on in their head and they're not acknowledging the impact that has on the global initiative, that can be a problem with where we're trying to go with the health equity and diversity inclusion.
Great points. Great points. Well, thank you so much, Adriana. It's nice to see and hear what the National Hispanic Nurses Association is doing. I'd like to ask Deneen Richmond to share with us what's happening at Luminous Health in Maryland. And I understand that you're making amazing strides, not only in your hospital, your health system, but also in the community and the region.
Yeah, so it's a journey. I think we all recognize that, but you got to get started on it. And it doesn't have to take 50 years. I'm sorry. If we took 50 years to figure out how to deal with this pandemic, we would all be dead. So we got to treat it the same way. So I'll just start out by saying we started our journey, and originally we called it our DEI journey. And actually it was in 2015 when the American Hospital Association issued its 1, 2, 3 equity pledge that kind of spurred us along. And so we started looking at our data. What were we doing as far as our racial, ethnic, and language data? Was it accurate? How were we collecting that data? We looked at diversity. We implemented at that time what's widely known in the NFL as the Rooney Rule. So in our organization, for every single leadership position, and it started at director and above, and now it's below at a supervisor and above, there has to be a diverse candidate in the finalist pool. So not just go out and find somebody and, we met this quota, but find qualified people, and we will hold positions until we do that. So it forced us to really source and recruit for candidates in a very different way. We don't accept, there's no one that looks like that, because we know that it is, but you have to be very intentional and how you source and recruit for candidates. And so we made a lot of progress, and we received the AHA Carolyn Boone Equity Award, and we could have rested on our laurels, but once again, everyone today has talked about, what was happening in 2020. And we recognized at that point that we still had a lot of work to do. So we had a governance-led, I think it's important, this has to start from leadership, Health Equity Task Force that led those first 3-4 years of work. So we decided that we needed to go back to the well, and our board spurred us on this because now that they are knowledgeable, they are activated. So we couldn't sit back anymore. And we actually formed what we called our Heart Force. And Heart Force stands for our Health Equity and Anti-Racism Task Force. So that's our Heart Force. And that group met for a year. And what we recognized, and it was once again governance-led, and we brought in all types of, it was regular staff members on there. There were executive leaders like myself. There were community partners, faith-based, business in the community, public health officials, you name it. We brought them all together as our Heart Force. We started with some education to get everyone up to speed, but we said this is not about issuing a statement. This is about taking action. And so we ended up with 10 recommendations that were unanimously approved by our board about 14, 15 months ago. And we grouped those recommendations in 3 areas. One was leading as an anti-racist organization and eradicating inequities in healthcare. We didn't want to make incremental change. If you don't set bold goals, you won't get there. So I am not about 5% improvement, 10% improvement. Set bold goals, set reasonable milestones, but make sure you're taking the actions to get there. And so as a result of that, we've made some huge improvements. You know, I know my colleague Deanna talked about you got to look at policies. Well, guess what? We had policies that were not anti-racist. You know, we were looking at things and saying, why is it, similar to what you said, that we have different rates of termination? And we recognized that one of our policies that was a racist policy, because when you looked at who was being impacted, was our leave and attendance policy. And many organizations, probably like us, had policies that said, oh, if you're late 3 times, then you know, you're going to get written up and you're going to go through the progressive disciplinary, et cetera. Well, think about this. What does late mean? So what does your hourly workforce look like compared to your other workforce? Does anybody say to me, oh, Deneen, you're late? But my frontline worker who has to clock in, and guess what? Some of those, I get in my car, so if I'm late, it's my fault, right? It's about when I decided to get up and leave my house, et cetera. Well, what about the employee who's relying on public transportation? Do they get to decide that the bus shows up late? And it may happen over and over and over again. So we had to really take a close look at things like that. The second area that we looked at was enhancing our culturally informed communication. And that one aspect of that was really looking at how are we truly partnering with our communities. We can be a convener, but we don't know it all. So even when we looked at what we were doing during the pandemic, it totally changed how we looked at things. When we first started offering vaccines to our community, I called it the Hunger Games, because the people who were coming into my boardroom didn't look like the community. And why is that? Because the people who had the internet and the resources and the underground connections and everything else, they figured out how to get those appointments, how to pass them along to their neighbors and friends. And then for everybody else, we wanted to say, oh, they're resistant, to the vaccine. Well, no, they couldn't get an appointment. And so we said, well, we're going to go out into our community. So I looked at our data, and 7 of the top 10 zip codes of the highest rates of COVID were all around one area, Hyattsville. And every single COVID vaccine site, and even before that we got to the vaccines, even testing, when we first stood up a test site, every single test site in and around our communities required an appointment, required that, you had to have a doctor's order. And so I went to the health department, I went to the city of Hyattsville, and I said, we're not going to do it that way. And everybody told me I was crazy, but guess what? We were the first test site in this community, no appointments necessary, no doctor's orders necessary. Drive up, and walk-up testing. And we opened on the evenings, and we opened on weekends when people could get there. And when we got about as far as we thought we could get with that, guess what? Then we said, we're gonna get even deeper into the community. So we went to barbershops. And I will tell you that, we had to truly meet people where they were. We went to food distribution sites. We went to the Home Depots where the day laborers gathered. And that's how we made a difference in our community, because we had a different mindset. And then our third area is around measuring and integrating accountability. And I would say what you measure matters, and what matters you have to measure. So we definitely look at our data, but we also make sure that we don't get into this data has to be perfect, because you will get paralyzed by that. So it's like, is the data good enough? Do we know what the trends are, and do we know where we need to take priorities? And that has showed us some things. And so I'll just really quickly, just on the data piece, we've been focusing a lot. I talked about the Rooney Rule on our workforce diversity. And so, by implementing some of those things, we were making a difference. And this past year, we actually achieved being a majority-minority organization. And you may sit there and say, oh, that's wonderful, but guess what? It's not. Because I could go out here and go to conferences and stuff and brag about that, but I'm going to be real and tell you that there's problems that are still there underneath of that statistic. So despite the fact that 53% of our workforce is diverse, when we look at leadership diversity, despite having our Rooney Rule and all the other things that we did, it's only about 39–40%. And we recognize that some of this is about, once again, mentioned by my colleague, we got to retain people. It's not just about recruiting them. We talk about diversity and inclusion. Diversity is being invited to the party. Inclusion is about being asked to dance. So we have to look at those things and really be real about, are we being inclusive? And then nursing specifically, we also look at that. And our nursing workforce is about 40% diverse. And our nursing leadership workforce is about 38% diverse. So once again, lagging behind the organization. But we also recognize that what's hidden in those numbers is that at one hospital, we have a significant number of diverse nurse leaders. And we just came together as a system about 3.5 years ago. At our other hospital, we still have some of those opportunities there. And we all have some opportunities around, on the language side, and our Hispanic, and all the other melting pot cultures that we have in our community that aren't represented in those numbers yet. So we are committed to really doing this work, and we're going beyond that. So because we've made some inroads, I have to give a very quick plug, because we are here at AARP, and I would be remiss if I didn't talk about, really quickly, the LEAD Collaborative. And I'm just thrilled. So LEAD stands for Leaders in Equity and Diversity. And it's funded by AARP. So they don't just talk about this stuff. They don't just put out statements. They make it happen. And that's what we all need to do. So we have over 30 organizations across 7 states that have just recently come together and all made a commitment to either work on workforce and leadership diversity, a social determinant of health, or working on a clinical disparity. And we are making them go through rapid cycle improvement, not 50 years, but every week, every single week. What are you going to do next? We have goals, what we're going to achieve by the end of, by next summer. But you can set a goal, and if you don't take steps every single day, every single week, you won't get there. So we have organizations that have made commitments to say, they are going to increase their board diversity by 50% to better mirror the geographic diversity of their client base. That they are going to increase the diverse leaders in their organization. We have a large Medicaid managed care plan that says that they have some very specific actions to increase access to fresh fruits and vegetables for their Medicaid population. We have one of our systems, we talk about social determinants, that has started a care caller program to address loneliness in their patient population. And then we have organizations that are working on addressing disparities on C-section rates, on diabetes control, and all of these other clinical indicators that if we all measure, we would find disparities in every single one of our organizations. So that's what we need to do. I'm all about research, but we have enough data, and we just need to now act on it. And I will just end really quickly with one of my people that I've learned from many, many years ago in my career, and that's Don Berwick. And he says very succinctly, that some is not soon is not a, what is it? Soon is not a number. Some is not a number, and soon is not a time. There is urgency. We have just gone through a pandemic, and it's not over. And guess what? Racism is our second pandemic that we have to address as urgently as we have been addressing COVID.
Thank you so much. Kudos to you and your leadership and what you're doing to make a difference in your communities. The courage, it really starts with leadership and courage, and just being focused and not and being relentless, really, right?
Relentless, I love that word.
We've come to the end of our time, but this has been a very, very engaging, humbling, eye-opening panel. There's a lot of work that has started, a lot still to be done, and I just would like to ask really quickly, if each of you could give us one action item, what do we need to go and do right now?
Rapid cycle improvement is what we need to do. Set an aim statement, use your data to then take action. We don't need any more statements, we need action. Rapid cycle improvement. There's an urgency to this.
Action, love it. Adriana.
Sure, mine's more of a request. If your organization is looking for developing pipelines for leadership for Latinos nurses, we're happy to collaborate and participate in building that going forward.
Awesome, collaboration.
I would say, so I absolutely agree with the data, but I look at it from the perspective of the young person who's seeking to be a nurse leader, and asking all of the nurse leaders in this room. I know that Jimmy earlier said be a mentor. One of my favorite pieces of advice I give to every person is build your own board of directors. In the same way organizations run themselves and have strategy and build goals, and have lots of different people on their team, have your own board of directors. Recognize that there's going to be lifetime membership. There's going to be people that you only need for this long, and there's people you haven't met yet that will inform your future.
Awesome, thank you.
I know it's been said, but it's worth repeating, sponsorship. So as leaders, sponsorship is next level mentorship. So how do we use our spaces, our places, our power, and our privilege to give individuals opportunities that they might not otherwise have access to, exposure to, or mentorship for? So as leaders, we need to not just mentor, but sponsor and give people those opportunities.
Awesome, thank you.
Mine would be to create sustainable programs. We all talk about programs and to get them up and running, but then once we get a target, is it going to go away? What are we going to do to keep it going? So that will be my call to action, is not to create the program, but how are you going to keep it going on? Because I have 2 boys. One is still 10, so he has a long way to go. And you never know, he might want to be a nurse.
We need them. Thank you all. Let's give them a round of applause.